Hello, I'm Councillor Jonathan Owen and I have a portfolio on the East Riding Council for Adults, Health and Care. Back in June, we had the first of a national series of inspections by the Care Quality Commission looking at how our adult services perform, but particularly how ourselves corporately and our partners fulfil our duties under what's called the Care Act. This wasn't an inspection of our in-house services and our own residential care, which already are either good or outstanding. Having been a councillor at the East Riding for a number of years, I was deeply disappointed with the results, which for the council came out as being classed as inadequate. Now that's not good enough, and as I say, I was exceedingly disappointed. One of the big issues was that although we prioritise people who are at high risk first, there are too many delays actually for those that aren't prioritised as high risk. We must do something about reducing those delays. We realise that some residents are waiting far too long to be assessed, and already we have an improvement plan in place. And of course, like all these inspections, timing is key, and we look forward to when the inspectors come back, sooner we hope rather than later, to see the improvements we think we're already making. One of the positives though of the report, which meant a lot to me, was the fact that the staff were highly thought of by the inspectors and going about their day-to-day work. And that's something was very, very pleasing to hear. In fact, when people do access our services, then the satisfaction rate is much higher than the national average. When you've spent a long time in local government, you have lots of ups and downs over the years. I've been around long enough now to have seen these sort of issues come and go in the past. And I must admit this result, although I wasn't pleased with it, has actually stimulated myself to work closely now with our great team of officers in adult social care, and hopefully over the next year and 18 months make some real improvements. That's a goal for me, and hopefully I can share that journey with our great staff in the council. We have a very interesting demographic of population in the East Riding with a growing elderly population, and that puts pressures on our service because it's probably one of the fastest growing elderly populations in the country. But the message I want to give, particularly to all our residents and their families or their carers, is that we'll do our utmost to make very rapid change here, to give the services I know our residents want and deserve. And that includes all those people that are probably hard to reach, that we haven't been very good at in the past, at understanding where they are and what their needs are. So I think it'll be a positive future for all of us moving forward.